Hello, I'm Dr. Michael Shuler from Athens Orthopedic Clinic. Today we're going to discuss Dupuytren's contracture. It's a very common disorder. It's associated with some nodules that typically form in your palm and that can typically pull the fingers down over time. So a little bit more background on Dupuytren's. Dupuytren's is a genetic disposition. They've actually traced it back to a raiding Viking who spread his seed along the European coast. It typically occurs in white people of Northern European descent. It is much less common in African Americans, Asians, or other ethnicities. It typically shows up 50s to 60s. It can show up with a very small nodule that most people don't even notice initially, and it can progress over time. It typically takes years to decades to progress to a point that can affect people with their function. So it can typically occur in the palmar aspect of the hand. It can occur on the backs of your knuckles. Additionally, it can occur in the arches of your feet. It's called lederhosens when it occurs in your feet. And in males, it can occur in your penis, which is called Peyronie's disease. These contractures are usually painless. They're something that has an insidious onset. Most people don't notice it initially, but over time they notice that their fingers can't hyperextend like they used to be able to, and in some cases it can get to the point that the fingers are actually pulled all the way down. So typically there's not a whole lot with regards to treatment for this. It is not something that we typically manage in its early stages. We typically recommend people to proceed with observation until it becomes something that affects function. For example, not being able to get your hand in a pocket, not being able to get your hand in a glove, those type activities will ultimately result in people seeking help and ultimately wanting to have something done. So therapy, splinting, stretching, it's certainly something you can try, but there's been no real significant data to suggest that this helps or prevents the progression of the contracture. If it gets to a point that it's affecting your daily living, there are interventions that we can proceed with. It used to be that we would make large zigzag incisions down through the palm, take out all of the tissue, and ultimately sew you back up. There was fairly extensive therapy after that, to the extent of 3 to 6 months worth of therapy to try and get your motion back. And in many cases, you did not ultimately get all of your motion back. So recently, over the last 5 to 10 years, a new treatment that has really vastly improved our ability to manage Dupuytren's has been developed. It's called a type 3 collagenase, meaning it chops up type 3 collagen. It's an injection that allows us to inject it directly into the nodules or the cords that are restricting motion, and it really has revolutionized the way we treat this. So if ultimately you have contractures, then certainly it's something that's typically worth addressing. Typically insurance companies at this point will approve the injections if you have 30 degrees of a contracture at this joint, which is called your MCP, or 20 degrees of contracture at this point, which is called your PIP. So the medication is quite expensive. It is not something that I would recommend doing with regards to if it's not affecting your daily living and you have not reached those limits with regards to contractures. Assuming you have, we're certainly happy to see you. There is a bit of a process to get these approved through insurance due to the expense of the medication. Once approved, it's typically performed in a 2-step process. So the first step is the injection itself. We typically numb up the hand. We can inject up to 2 vials of the medication at one time. During that injection, again, we numb up the hand, and then it's a little bit of a misnomer from a single injection. We basically will run the needle throughout those cords, injecting that medicine in small aliquots into that hard tissue. So after the initial injection, it's not uncommon to have fairly significant swelling. You can get some even discoloration, blue, black. You can have soreness or itching that runs up into the elbow or even into the axilla or the armpit region. This is all fairly common and does not indicate typically anything bad happening. So the second step, we typically wait 2 days. Some people wait just a day. In my opinion and experience, waiting 2 days allows for a little bit of the swelling and pain to go down. At the 2-day mark, we will again repeat the injection of numbing medicine so that the finger is numbed up, and then ultimately we proceed with what's called a manipulation. This might, in your opinion, look like I'm trying to break your finger. I'm not, but typically we'll obtain some snaps, cracks, and pops as those cords are torn. And it really does an amazing job of softening up or tenderizing those hard nodules in the palm. During the manipulation process, again, depending on how swollen you still are, there is a risk of what's called a skin tear. Again, that also depends on how much of a contracture there is. As you straighten the finger out that's been bent for many, many years in a fairly flexed position, there is a risk of tearing that skin as that skin gets stretched back out. If this occurs, it's not something to worry about. These tears typically will heal in without any need for additional intervention. In severe cases, we need to proceed with multiple injections. These injections typically are required to have approximately a 30-day period in between the injections. And so again, depending on how much of a contracture, how much of the Dupuytren's is present at the first initiation, we may ultimately talk about repeating this cycle over even a couple or multiple times, depending on, again, the severity of the disease and the contractures. So again, the main thing to remember with this is, one, it's genetic. We can't cure you of this. Two, my goal is to maintain function, and so getting rid of every little knot and nodule is not the goal. The ultimate goal is to maintain function that allows you to use the hands as normally as possible. And so ultimately it's up to you with regards to if we need to proceed with additional injections. That's something that you will ultimately tell me. I won't be telling you. In summary, Dupuytren's is a genetic disposition. It's nothing to worry about from a standpoint of it's not a cancer. It won't spread. It's limited to really 3 areas of the body and may ultimately be something that you never ultimately have to deal with. If it gets to a point where it's affecting function, we now have a very good option that is minimally invasive. It does allow you to proceed with really normal function afterwards. After the injection, you're able to perform any and all activities. We will ask that you wear a splint for several months afterwards during nighttime, simply to prevent the contracture from reoccurring. But really, it's revolutionized our ability to treat this without undergoing a very large surgery and significant therapy afterwards. So that's about it for Dupuytren's. Hopefully this has been helpful in understanding what exactly it is and how we manage it. If there's additional questions, please feel free to let me know.